This is a special education presentation assessment. What is a special education assessment? A special education assessment is the process used to figure out a child's learning strengths and needs. It's used to determine if a child is eligible for special education services. It's a collection of information to determine if a child needs to receive special education services. So who gets assessed? Children who are suspected of having a disability are assessed for special education services because they show significant needs in areas of academic performance, behavior, intelligence, language, perceptual functioning, physical development, and social and emotional functioning. They fall into 13 categories under the Individuals with Disabilities Education Act, or IDEA. What are the categories of disabilities? The IDEA lists 13 separate categories of disabilities under which children may be eligible for special education and related services. Deafness is a severe hearing impairment that hinders a child's processing lingual information with or without amplification. Hearing impairment is an impairment in hearing, whether it's permanent or not. Visual impairment is a visual difficulty that negatively affects a child's educational performance. Speech or language impairment is a communication disorder that hinders speech or language. Orthopedic impairment is physical disabilities and other impairments. Other health impairments is limited strength or alertness due to a chronic or acute health problem. Autism is a developmental disability that affects verbal and nonverbal communication and social interaction, usually seen before age 3. Mental retardation, which we don't use nowadays, is having below average intellectual function and IQ of 70 or less with a deficiency of skill for independence. Serious emotional disturbance is a disability where a child of average intelligence has difficulty with personal relationships and they display inappropriate behavior, emotions, sadness, and fear. Categories that overlap disabilities are multiple disabilities, when 2 or more disabilities together require special accommodation. Serious emotional disturbance is when a child of average intelligence has difficulty building personal relationships. They respond appropriately under normal circumstances, and they often present as unhappy and unafraid. Specific learning disability is when 1 or more basic psychological processes involved in understanding or communicating is displayed, and traumatic brain injury, when an injury to the brain caused by an external physical force results in a disability, behavioral impairment, or both. So what are the components of the assessment process? The 5 components of the assessment process are collection, analysis, evaluation, determination, and recommendation. Collection is gathering background information from many sources at home or school. Analysis is processing and understanding patterns in a child's combined history. Evaluation is looking at all areas of a child's development to determine their strengths and their weaknesses. In most states, schools will have a school-based team which reviews children who are considered high risk and attempt to resolve the child's issues. If they can't, a multidisciplinary team, or MDT, who are licensed professionals, will have a more formal evaluation with 6 standards. They are parental consent of a school's proposed action that must have been written before the initial evaluation, for suspected disability, and eligibility for special education is requested. They must be non-discriminatory racially or culturally. They need to be validated for specific disabilities. They must be given by trained administrators. They must be comprehensive and given in a student's native language. There are several types of assessments: cognitive, academic, behavioral, social, and emotional, and special, which cover physical attributes. Determination is when the presence of a suspected disability is confirmed based on criteria. The MDT write a report of findings, and they have to recommend in third person, and a packet is prepared for an IEP meeting. A recommendation for an educational program is then made to the school, teachers, and parents. And in the end, an IEP meeting is held. That is the process.